Welcome, Aging and Geriatric Medicine. In this course, we discuss some very important points related to age, healthy age, and the problem in all elderly people. Aging is a gradual, continuous process of natural change that begins in early adulthood. During early middle age, many bodily functions begin to gradually decline. Aging is a natural process of structural decay that all living organisms undergo. It's caused by intrinsic processes, genomic instability and telomeric attrition, and interaction with the environment, exposure to sunlight and toxins. People don't become old or elderly at any specific age. Traditionally, age 65 has been designated as the beginning of old age, but the reason was based in history, not biology. Many years ago, age 65 was chosen as the age for retirement in Germany, the first nation to establish a retirement program. In 1965 in the United States, age 65 was designated as the eligibility age for Medicare insurance. This age is close to actual retirement age of most people in economically advanced societies. When a person becomes old can be answered in different ways. Chronologic age is based slowly on the passage of time. It's a person's age in years. Chronologic age has limited significance in terms of health. Biological age refers to changes in the body that commonly occur as people age, because these changes affect some people sooner than others. Psychological age is based on how people act and feel. For example, an 80-year-old who works, plans, look forward to future events, and participate in many activities is considered psychologically younger. Healthy aging refers to reduction in the undesired effect of aging, following a nutritious diet, avoiding cigarette smoking and excessive alcohol use, exercising regularly, staying mentally active. Geriatric medicine is a medical specialty focused on providing care for the unique health needs of older adults. The term geriatric originates from the Greek meaning old man and iatros meaning healer. Characteristic of geriatric medicine: atypical presentation, simple intervention can often make a big difference, multiple pathology, reduced hemostatic reserve, impaired immunity. The geriatric giants were originally coined by Bernard Isaac, a professor of geriatric medicine. Incontinence, immobility, instability, falls and syncope, intellectual impairment, delirium and dementia. Several different illnesses can present as one of the geriatric giants. Two common examples also begin with the letter I: iatrogenic disease caused by medication and infection. The common source of sepsis in older people are the chest, urine, and the biliary tract. Prescribing in older people: most older people are on regular medication. Pharmacokinetic and pharmacodynamic are different in this age group. Older people are much more likely to suffer from the side effect of drug. Polypharmacy and the problem with concordance are particular issue in geriatric medicine, and we discuss these subject one by one inside the course. Delirium is a common in older people but is often not recognized. It can present with a wide range of symptoms and signs. Patients at high risk of developing delirium can be identified, and it can sometimes be prevented. Treatment of delirium involves environmental measures as well as treatment of the underlying cause. Falls in older people are common. Recurrent falls are rarely mechanical, accidental. The consequence of fall in older people include loss of confidence, loss of independence, and fracture. There is good evidence that simple interventions can prevent falls. Syncope, collapse with transient loss of consciousness in common clinical problem. The most important diagnostic tool is the history, including an eyewitness account if possible. In syncope, the underlying cause will be obvious in more than 1/3 of cases after history examination, lying understanding, blood pressure, and 12-lead electrocardiogram. An explained syncope requires investigation if it's recurrent or if a single episode leads to a significant injury. Transient ischemic attack or stroke. Transient ischemic attack and stroke are medical emergencies that require urgent assessment. Patients with high risk TIA or stroke should be admitted to hospital. Stroke unit care significantly reduce death and disability. Modifying risk factor and starting secondary prevention reduce the risk of subsequent stroke. Dementia. Dementia is common in old age, especially extreme old age. People with dementia should be assessed thoroughly. The general management of the people with dementia in health and social care should be improved. Urinary incontinence is common among older people. The impact of incontinence is significant. Incontinence is not an inevitable consequence of aging. It can be treated after proper assessment. A lot can be done to promote the comfort and dignity of older people with intractable incontinence. Thank you and see you inside the course.